Welcome back. Once again, I'm Kirsten Murphy, Executive Director for the Vermont Developmental Disabilities Council. And this is the installment of our video presentation of the years 1 and 2 work plans for our federal fiscal years 22 and 23. This segment will be reviewing gaps in services. So I will begin sharing my slides. For those of you that are following the slides, these are slides 24 through 32. All right, let's get to it. Gaps in services. This is goal area 2, and there are 3 objectives. The first area is universal design, objective 2.1, which reads, working with community partners, the DD Council will advocate that spaces and programs for recreation, health, and wellness are fully accessible and follow the principles of universal design. You'll remember that I said that there are some goal areas where the council is new to the work and needs to do some research and development of relationships before we're in a strong position to act on implementing that objective and different activities. So this is certainly one of those areas. And you will see that remember the activities over here, in fact, follow exactly what I said, building relationships. We're going to conduct some focus groups, interview key stakeholders and potential partners, including healthcare professionals, Vermont Agency of Parks and Recreation, the Vermont Department of Tourism and Marketing, and our friends at an interesting project called Oakledge for All, which is an accessible playground project in Burlington. You see their logo right there. And then we're going to summarize those findings. We're also going to do some research that's more traditional by following legislation and Vermont-specific position papers and other policy pieces that review how the Americans with Disabilities Act, accessibility requirements around web design and other aspects of universal design are being implemented here in Vermont. So we'll see then a couple of outcomes at the end of year 2. Remember, that's 2 out of 5, so we have more time to continue to work on this. Outcome 1, the council has built relationships with Americans with Disabilities Act experts, accessibility advocates, and key decision makers who are concerned about increasing accessibility in Vermont. Second outcome, staff will become knowledgeable about universal design, especially as it applies to healthcare and recreational settings. We learned from our focus groups and other information gathering that there was a particular concern around accessibility in healthcare settings, especially outpatient clinics. And that is certainly something that we'll be looking at, as well as the desire for more recreational space that people with disabilities of a wide range of disabilities can use comfortably. Continuing on universal design, I see a typo here. We are also going to begin to make some initial investments, and then we have a particular project that's already underway around accessibility. So investments, the activities are going to include ADA enforcement, accessibility awareness, and universal design projects as a subject for SEEDS grants, SEED grant proposals. So SEEDS grants are small mini grants, we call them, between $10,000 and $15,000. And typically we post the grant opportunity, but we also reach out to potential applicants. For example, Oakledge for All, I mentioned that project, and the UVM Empower program, which is a wonderful project at the UVM Children's Hospital that helps make inpatient experience, the inpatient experience more comfortable for children with disabilities, especially sensory differences, high anxiety, and autism. So we hope that those activities, along with our resources, remember, will result in an outcome, small, well-placed investments in accessibility, change the built environment, and raise awareness about universal design. Now, I mentioned that there is a project already underway, and that is what we're calling our Vaccine Access Project. We're still looking for a nice brand name for this. The council received a special grant through an executive order from the Biden administration, which routed some money from the Centers for Disease Control to DD councils, specifically for working on vaccine access for the COVID-19 vaccine. And all the councils received pieces of that money. For us, it was about $28,000. And we worked with our partners to figure out what the best use in Vermont would be for our particular fund. And we identified a need for preparing clinical settings, pediatric settings, family medicine settings, so that children and youth with disabilities can come into their primary care provider's office and have that expectation that there are people informed about how to administer vaccine to children with disabilities, youth with disabilities, again, who have sensory differences, autism, high anxiety. So our goal in that project is not only to get the COVID-19 vaccination out there as soon as it's available for children 2 to 11, or to increase rates for children 12 to 18, but it is to do so without the experience being traumatic or overly stressful for the children and youth involved. So our Vaccine Access Project has some activities with Vermont Family Network and other groups, develop training and protocols that reach 75% of vaccine-ready medical practices that see children 2 to 18 years, and share sensory toolkits with these practitioners. The outcome of that project will be that children and youth with sensory issues, anxiety, etc., have access to vaccines in a setting prepared to accommodate their needs and to reduce stress. And then, as you know, we will move to the outputs of these projects, which are concrete things that are going to be created by council work. And we hope that the council will create written summaries of research findings, focus groups, and stakeholder input regarding universal design, training curriculum for medical providers, regarding how to accommodate children with sensory issues, anxiety, and other disabilities when receiving a vaccine, and then sensory toolkits for medical practitioners that see children. All right, that was a nice short and sweet objective. We're going to move now to objective 2.2, which is housing. Certainly something that many, many people have expressed to us, the desire to have affordable housing and to have more choices in the model of housing that is available to people who are receiving home and community-based services. The objective reads, working with community partners, the council will develop and promote housing options for adults with intellectual and developmental disabilities. These living options must be affordable, foster independence, ensure necessary support, and assist in the development of friendships and other community connections. And our activities are threefold. Building relationships. Again, this is an area where we need to do some foundational work, conduct some focus groups, interview key stakeholders, and join the Vermont Affordable Housing Coalition. We're going to do some traditional research, follow legislation and Vermont-specific research, and summarize those findings and recommendations in a white paper. So those two foundational activities will result in these outcomes. The council has built relationships with housing experts, housing advocates, and key decision makers who are concerned about housing. And staff will become knowledgeable about housing issues, especially models for supported housing for people with intellectual and developmental disabilities. Those will be the outcomes in 2 years. Then in a new work stream that we can begin already, we're going to advocate that pot of money that is being referred to as the home and community-based funds or one-time funds. It's a pot of about $162 million for home and community-based services. We'll be advocating that some of that money be used to stand up 2 new housing models. We don't know what those models will be. We just want 2 alternatives for people to choose from, along with the traditional menu of shared living, living with your family, or living on your own independently by yourself. And we will also be advocating strongly that Vermont enforce the home and community-based settings rule, which is a 2014 set of rules that were promulgated by CMS, the Centers for Medicaid and Medicare Services. So CMS rules are binding. The implementation of this rule has been delayed, but it will no longer be delayed in the 2-year window coming up. And we will be advocating that Vermont fully enforce that rule, which looks at ensuring that settings are truly home-like and not institutional in nature in any way. The outcome of that advocacy work will be that people with intellectual and developmental disabilities have at least 2 additional housing models from which to choose for their living situation. So then we look at some of the objectives, or rather outputs, and we hope that the council will create a white paper that summarizes research findings and recommendations by self-advocates and family members regarding new housing models. We also hope that we will have talking points, public comment, and a housing campaign ready to roll by year 3. So that will be the materials that support our advocacy work. Finally, we're going to come to objective 2.3. We have a member who's been very adamant that we work on transportation, and kudos to that member. We have it right here in our 5-year plan. So this objective reads, working with community partners, the council will develop and promote more affordable, convenient, and flexible transportation options for people with developmental disabilities. We feel a little closer to being ready to work on this. So building of relationships, these activities have been moved up to the pink category, to the new activity category, rather than we have to kind of begin this work. And this will be sort of on an accelerated track. Meet with Department of Transportation officials and follow the, I believe E&D stands for elderly, not my favorite word, and disability advisory group at the Department of Transportation. So following that new advisory group, or new to us, that advisory group. And also testify in committees of jurisdiction at the legislature. Indeed, we've already have a member who's arranged for some of that. We will also do some traditional research and learn about models in other states and about something called microtransit. I'm excited to learn more about what that is. It has to do with creating transportation that is highly local and responsive to specific local needs. So those 2 activities will result in these outcomes. Council staff and members know key legislators on the transportation committees and at the Department of Transportation. And then staff will become knowledgeable about transportation issues, especially microtransit and other models for rural areas. And finally, again, just in the same way that we did with housing, there is an advocacy activity or cluster of activities. Again, we're going to be advocating, in fact, we already are, that this home and community-based one-time fund, that $162 million, we're advocating that some of it be used to stand up a fleet of vehicles available regionally to recipients of home and community-based care, regardless of which program they're in. So kind of a shared resource across different programs. We're going to be advocating that transportation be embedded in supported housing for people with intellectual and developmental disabilities. So a nice crossover there with our previous objective on housing. And then we're going to be advocating that one microtransit option be added to one region. So it's an opportunity to try out something one time, either through a seeds grant or through some kind of advocacy that we undertake as a staff. And hopefully, if that's successful, then we can scale up that effort to impact more regions in the state. But that's beyond years 1 and 2. So we have collectively an outcome. People with disabilities have more equitable and frequent access to transportation. And then we will see some outputs, new relationships on which to build strategic partnerships in the transportation arena. A well-researched list of recommendations to improve access to transportation and equitable reimbursement rates for this service. We have heard that the rates vary by region, at least in terms of the developmental disabilities services agencies. That there are 1 to 3 policy changes that eliminate barriers to affordable, convenient transportation, and that there's 1 regional campaign to introduce a microtransit option. That concludes the 3 objectives for goal area 2. And here we summarize that goal area, remember, with some of those other labels that the Administration for Community Living likes to use to kind of place what we're doing. So these 3 objectives are going to actually cover 6 areas of emphasis: health and healthcare, formal and informal supports, that's home and community-based supports, quality assurance, and then, as you might expect, recreation, housing, transportation. This goal area doesn't happen to cover any of the Act's requirements, but this, and then we look at the strategies, and this goal area uses at least 6 of the 11 strategies. There's outreach, technical assistance, the elimination of barriers, remember that would be in the transportation area, demonstration of new approaches, again in housing, coordination with related councils, and interagency collaboration and coordination, especially with the Department of Transportation, a entity in state government that we haven't worked with before. So it's exciting to think about that new relationship and new opportunities to do some impactful work. And with that, I will conclude this section of the presentation. Thank you.